introduction of the risk management standard to private health insurers represents the most significant change since the transition from the fee Act to APRA back in 2015. So with that in mind, Kath, I might just get you to start with a brief overview of APRA's prudential policy framework and where CPS 220 fits within that.
Sure, thanks Renae. The shift in 2015 from fee Act to APRA did represent one of the most significant changes in the health insurance industry. With APRA taking over, they obviously have a different focus, and although it was significantly a lift and shift of the existing regulations, APRA did flag early on that they were going to make some changes to bring the health insurers into their more general framework. From August 2016, they have announced that the focus for the first three stages is going to be risk management, governance and capital. And CPS 220 represents the risk management piece of that, which is going to be a really significant change to health insurers. This first phase also includes some consultation around the role of the appointed actuary, but I would say that consultation is still open now until December. The focus on risk management is really consistent with APRA's focus on risk management across all of the financial services sector, so it's no surprise that they've started with this for health insurers.
So with that backdrop, let's now jump into some of the detail of CPS 220. Can I get you to talk through the key features of the standard and how best organisations might be able to demonstrate compliance with those requirements?
So underpinning all of these changes is a real focus on risk culture. This is something that should be modelled by the board and the CEO and permeate through the organisation, and is definitely a challenging piece. It's challenging for organisations to think about how to measure, how to monitor, and how to control and change and influence the culture. It's proven to be a real challenge in implementations of 220 across the sectors. The other thing that needs to be done on an annual and a triennial basis is reviews of the risk management framework. The annual reviews would be done normally by internal audit or your external auditors, and would cover the whole risk management framework across the 3 years. It's important that these are well planned and to avoid sort of end loading the work. The other thing is then the triennial review, which needs to be done by an operationally independent person who's not been involved in the design or implementation of the risk management framework. It tends to look across, at a higher level, across the whole risk management framework and how it operates. And those are being done now for a large number of organisations as they hit their 3 years. Finally, the board must make an annual risk management declaration. This is something that may be challenging for health insurers. They've not had to do anything like this in the past, so it's something just to be prepared for and ensure the board is ready for the sign-off that will be required when this occurs on an annual basis.
So from your work with other organisations, can you share with us what you see APRA looking for when they're assessing risk management?
So in our experience, one of the most difficult pieces in these reviews is the assessment of how well the risk appetite statement and the risk management framework overall is embedded across the whole organisation. It's important to get the tone from the top right, but also the tone from the middle, and ensuring that when you speak to frontline staff as part of the reviews, that they understand their role within the risk appetite framework and that the risk appetite statement is meaningful and effective in their roles. It's very easy to say that those who've prepared in advance, obviously, and who've considered things such as gap analysis do find themselves in a much stronger position when it comes to doing the reviews. Getting that kind of housekeeping right, tidying up policies and procedures, ensuring that there's a comprehensive documentation framework behind the risk appetite statement, including things like minutes of meetings, which is a key part of what APRA likes to see, evidence of challenge with the CRO. These are all important parts that and simple things that can be done to demonstrate compliance as you head into your reviews and as you prepare for CPS 220.